Good evening, my name is Erica Rupert. I will be performing the skill of hanging an IV piggyback. The first thing I want to do is gather my supplies, go into the patient's room and close the door for privacy, go over to the patient, introduce myself, go over the procedure that we'll be doing with hanging the IV antibiotic. And then the second thing I would do is go to the patient, make sure that their ID bracelet matches their name and date of birth after I ask them. And then also make sure the patient does not have any allergies. And then I will also check their site to make sure it's not infiltrated and that everything is dry and intact. And after that, I will clean my hands and put on the proper PPE that I need to do with aseptic technique. I will also make sure I have the right patient, the right drug, the right dose, the right time, and the right route. And then my supplies, what I have is for my piggyback. I have the order and make sure it is compared against the physician's order, that we have the right dose. We are to have 50 milliliters to infuse over 30 minutes. I will make sure that my piggyback is hung above my primary line. I will then take my secondary line and make sure that it is clamped. I will then spike my bag for my piggyback. After that, I'll make sure the chamber fills halfway through. And then unclamp your line and make sure that there's no air bubbles in the tubing. Then reclamp your line. And after that, you will take an alcohol swab and make sure that you clean the Y port on the primary line, the first Y port. Allow for a minute or until the port is dry. Do not put it on while it's still wet. Allow it to dry. And after that, you will connect your secondary to your primary on the Y port. We will then make sure that it's infusing properly on the machine. Make sure that the 50 milliliters infusing over 30 minutes for the piggyback. And then you will also take a label and put the date on it, the time and date on it. And then after that, you will go over to the patient, make sure you check their site, it's not infiltrated, there's no contraindications. Make sure you just explain to them if they could have any adverse reactions. And then you would make sure that you make sure they're safe. If they have a call light, they have their call light next to them. If their bed's in low position, make sure they're safe before you leave the room. Then you would take off your gloves. Provide hand hygiene. Dispose of your supplies. And then after that, you will go back and document and make sure if the patient had an adverse reaction to the IV, you would document that as well, the time and the date. And then also check on the patient every 1 to 4 hours and make sure that the IV is infusing properly. Thank you.